A new report from secondstreet.org analyzed how many Canadians die waiting for healthcare, and the results are fairly concerning. According to the report, at least 17,032 patients died in Canada while waiting for surgery or a diagnostic scan from April of 2022 to March of 2023. Those who did die were recorded to have waited for care from as short as a week to as long as nearly 11 years. Annual surgical waiting list deaths are up 30% over the past year, and the report also notes that over the last 30 years, healthcare spending on a per capita basis has increased by more than twice the rate of inflation. Joining us now is Colin Craig, president at secondstreet.org. Colin, thank you very much for joining us on Forum Daily.
Thanks for having me, David.
So, I mean, these are obviously alarming numbers, but can you explain to us the data that was used to come to these conclusions and what it actually means when someone is deemed to have died while waiting for care?
Yeah, so I think as a lot of Canadians know, governments maintain waiting lists. They have computers that handle the whole list of people that are waiting for, say, knee surgery, heart surgery, all kinds of different procedures. And when someone phones up to cancel a procedure, the people that run those systems have to click a button and decide, what the reason is for the cancellation. And one option often in those systems is that the patient has passed away. So what we did is we asked governments across Canada for data on how often it's happening that patients are dying while waiting for not only surgery but diagnostic scans. And we try and gather as much data as we can. We don't get data from every province or health region. So there are gaps
Mhm.
in the data that way, and then some provinces and health regions will say, "Well, we've got data for patients dying while waiting for surgery, but we don't track that when it comes to diagnostic scans." So there's a lot of holes in the data. If you try and extrapolate some of the numbers, it looks like the true figure is over 30,000 patients that died. So it's people waiting for a variety of causes, like I said, and as you noted, it can be anywhere from less than a week to 11 years. But certainly, what we have seen is that these numbers are increasing over time. And so, what it means is that quite often patients are either suffering in their final years because they're waiting for procedures which could improve their quality of life, or they're waiting for procedures that, in some cases, could save their lives.
Mhm. And what are some of the root causes of why so many Canadians have to wait for healthcare?
It's a very big topic. I think there's multiple reasons that contribute to why we have such long waiting lists in Canada. One of which is the structure of the system. As we've talked about, there's a lot of money in the system. Spending on a per person basis has increased at nearly double the rate of inflation. So there's lots of money in the system. We've got good people that work in the system. I think everyone knows a nice doctor, a nice nurse that got into the system because they want to help patients. That's not the problem. The
Mhm.
problem is the structure of the system itself. So there's a few things that Canada does that other nations don't do. One of which is with our universal healthcare system. We Governments do a lot to try to force everyone to use it rather than giving them a choice between using the public system or private options. So when you look at private universal healthcare systems, say in European countries like Sweden, for example, they don't do that. They give patients a choice between using their public system or private options. And when some patients decide to pay for private options, it takes pressure off of the public system. So that would be one thing that Canada could do to improve what's happening.
Yeah, I mean, that's really interesting, the comparison between a country like Sweden and a country like Canada, and obviously some provision for private care in that structure. Um, y- you've noted both before and now that that spending has increased on a per capita basis, and yet wait times are also increasing. Can you walk us through why that does not add up and why more spending is not equaling better care? We have about 40 seconds before we have to go to the
Sure.
break, and we can pick right back up when we return.
Yeah, I think simply put, the government isn't very efficient at how it runs services. So you have money that's not spent effectively. Sometimes that money is not trickling down to where it should be, which is paying for nurses and doctors and hospital beds so that patients can get the care that they need. So I think that's a big part of the problem really, is that the money's in the system, but it's not getting to the front lines so that they can actually help
Hmm.
patients.
You had mentioned that there was money in the system, but that it's not necessarily trickling down to the people or the areas that need it, which begs the question of where is it going? If healthcare spending is going up, but it's not necessarily going to doctors or to hire more doctors, where is that money going?
Yeah, so I think it's a variety of things. One of which is that too much money on administration. Paying people to sit behind desks rather than helping patients at their bedside. Those types of things, doing surgery. So I think that's part of the problem. Another is that because we kind of clamp down on private options in this country, you don't have the same innovation that you might see in other countries where there is that dynamic between having a stronger private sector and a strong public sector, and they can both learn from each other and that. So that is a problem. Anecdotally, just the way that hospitals are set up, sometimes they're not set up very efficiently. I talked to a surgeon not too long ago, and he described how, after a patient would have surgery, the surgeon would have to be running around the hospital looking for a pillow just to help the patient because there weren't pillows
Yeah.
nearby. Like it's not set up in a smart manner so that, like almost like a streamline assembly line. You want to get quality care into patients, help them get back on their feet, help them, return to as good a life as possible, get them out the door so that the next patient can come in and move that along as quickly as possible so that you can help as many patients as possible. So, it's things like that. Like I say, the money's in the system, but we need to, part of the problem is figuring out how to manage healthcare in a better way.
And what are some of the most common things that Canadians are left waiting for when it comes to healthcare? Are we talking uh, MCL, ACL tears, and injuries of that nature, or is it much more serious than that?
Yeah, it's a very good question. Ideally, we would be able to tell you the answer. The problem is that the data isn't always clear from different jurisdictions. So some health bodies are very good. For example, Nova Scotia probably provides the best data in the country, and you can see exactly, everything that patients were waiting for when they passed away, broken down on a case by case basis. And obviously, all the personal information is removed. We don't receive names, and we don't certainly don't ask for it.
Mhm.
In other jurisdictions, they'll say there were 32 patients that passed away while waiting for surgery, and that's all that we get. So we don't know what they were waiting for. But when you look at cases where there is data, it seems like the vast majority are cases where people are waiting for procedures which aren't going to save their lives. So that's good news. These are things like cataract surgery, hip and knee operations, those types of things. But you still can't really discount those because quite often it means that there's someone suffering in their final years before they pass away. And no one wants to spend the final year or two of their life with cloudy vision because they're waiting for cataract surgery, or maybe even stuck in their apartment living with chronic pain because they're waiting for a knee or hip operation. And in those cases, actually, you could see how a long wait time could maybe lead to a premature death. If you're stuck immobile waiting for, say, a knee operation and you're not moving around, you're not getting regular exercise, well, then that can cause other
Yep.
problems in your system, and maybe you have a heart attack or something else. So, um, overall, I think sadly what the numbers are showing is that there's a lot of suffering going on. And unless we see some bold healthcare reform to copy what other countries are doing that are helping them deliver better care, unless we see those changes happening, then we're going to see a lot of patient suffering in the years ahead.
You mentioned bold reform and copying what some other countries have done. In your view, what is the best model for the Canadian system to emulate?
Well, that's a good question. I think we really need to look at European countries. They do a lot of different things differently. Like I said, they give patients a choice between public and private options. They often partner with private providers to get that care to patients. That's something they do. The European Union does something really good, which They allow patients to go to other countries, pay for surgery, and then get reimbursed by their home country for up to what that country would have spent
Okay.
locally. And what this does is it immediately opens up thousands of opportunities for patients to go out and find the care they need in a timely manner. It also gives them some money to use, right? So, that's often not an option for lower income and many middle income Canadians right now. So, that's something really positive that the European Union does. If Canada copied that, then suddenly a lot of Canadian patients could get off a waiting list and they could get the care that they need.
Colin, thank you very much for joining us today. We really appreciate it.
Well, thanks for having me, David.